Hello, my name is Dr. Ibi. I welcome you once again to this channel, Beyond the Consulting Room, where I talk about issues that concern your human dignity and well-being. In this video, I want to talk about food supplements, sometimes what we call nutritional supplements or dietary supplements. They usually contain vitamins like vitamin A, B, C, D, E, or K, or what we call minerals like calcium, iron, zinc, magnesium, and so on. Sometimes amino acids. These are derivatives from proteins. Sometimes some herbs or what we call botanicals, and many other ingredients can be found in food supplements. All right. Now, as the name implies, food supplements are meant to be additions to your diet to probably augment your nutritional needs or to complete it or to enhance it. So they are not like replacement for the foods you eat. Okay, so that it could be possible that if you eat a healthy, balanced diet, you might not need food supplements. But there are some rare situations, or there are some situations whereby people would need to be on food supplements, yes. But for most adults, healthy adults taking a healthy, balanced diet, they might not need to be on food supplements. And the assumption that food supplements are devoid of risks or adverse effects is not entirely true. These are products that are processed, all right, that has some ingredients, several ingredients. So you could react to some of these ingredients. You could have some nausea, some abdominal discomfort, some allergic reactions to some of these ingredients in the food supplements. So we should not have the assumption that they cannot cause any harm to us, especially in the long term. In the long term, if we take them so long, we abuse them, any product you abuse can lead to harm in the long run. We also know that they have the risk of interfering or interacting with some prescribed medications. They have some components. There are some that have some components that can do that, especially some herbal ingredients or components. Some can even interfere with some lab test results. Okay, so don't think that they are entirely devoid of risks. So you can take them as long as you want, even when you're not deriving any benefits from them. Okay? So who will need a food supplement? There are about 4 situations that somebody might need a food supplement. Number 1, the person cannot take in enough because of some poor appetite. So you have some chronic or long-standing poor appetite, maybe because you have some disease, and you're not eating well. So you think that you need food supplements. Or maybe you have some difficulty swallowing food. You have a tumor in your throat or in your stomach. You might find it difficult to swallow food, or you might bring out food most of the time. When you swallow the food, it might just come out because of the tumor in your stomach, for instance. So this can be reasons why you might want to give somebody a food supplement, because the person is not going to take in enough food. Another reason why a person might not take in enough is because the person probably is on some restricted diet. Maybe the person has a medical condition, must be on some restricted diet, so the person might not benefit from a variety of sources of food or nutrients. Okay, some even have some food allergies. Because they have food allergies, they cannot take in certain foods. In that sense, we have to supplement their diets with nutrients that they need in those food. All right. So these are situations whereby somebody does not take in enough for some reasons. But we can also have the situation whereby somebody can take in enough food, but the person is not able to absorb enough nutrients. All right. Why? Because the person has what we call malabsorption, or problems with absorbing food. Okay, in that sense, well, we have diseases that can impair your absorption of your digestion and absorption of some food. You also have structural problems that can happen to your intestine. It can be too short, it can be a birth defect, or it can be because of some surgery that has been done on your intestine to remove a portion of it because of some problem you have. All this can impair absorption of some nutrients into your body. So you might need some food supplementation because of absorption problems. A third reason why you might need food supplements is because you have an increased requirement for certain nutrients. All right. So if you are pregnant, even though you have good appetite, you can take in enough food, you don't have absorption problems. We think that you are taking in nutrients for both yourself and your fetus. So it makes sense that eating for two is not an easy thing to do. So we want to give you some supplements to help the two of you, the mother and the fetus. So we might give you some iron supplements because we know that if you don't do that, your iron level, your hemoglobin level could be low. You can have anemia in pregnancy. And this iron supplements usually will come with some other multivitamins and minerals. Okay, so these are situations where someone has an increased need of some nutrients or of nutrients. It can be because the person has some disease, chronic disease, and we want to make sure the person has an immunity strong enough to fight this disease. So you might give some supplements to make sure the person has the right amount of nutrients to have a strong immunity to fight this particular disease or infection we are talking about, even as a person is on treatment for this infections or diseases. Okay, this is a situation of an increased need of some nutrients because of some peculiar issues. The fourth scenario has to do with where, for a reason, we believe that you are deficient of certain nutrients, either by your presentation, your clinical presentation, your symptoms or your signs, or by doing some lab tests. We can tell that you are in need of certain nutrients. For instance, we can tell that you are anemic. So, and when we do a test, we realize your hemoglobin level is low, and we are able to tell that it's because of iron deficiency. We can supplement your diet with iron, which will come with other multivitamins and some minerals in a way. Okay, but that is to correct a deficiency. We have a reason to prove that there's a deficiency. Then some people, some older people, may need some calcium or vitamin D supplement to prevent osteoporosis. So in that sense, you can give calcium and vitamin D supplements. Again, you have a reason to believe there is a deficiency or there could be a deficiency. Some people are given vitamin C because they have some bleeding gum because scurvy. That again, there's a reason to give that. Some people have been found to have some night blindness, and we think the night blindness is coming from vitamin A deficiency. You must supplement their diet with vitamin A. There are some also who have some vitamin B deficiencies, or we have reason to believe that they might need vitamin B components because they have some nerve issues, what we call neuropathy. Okay, so you supplement their diet with vitamin B components. All I'm saying is that in all these instances, there are reasons to supplement somebody's diet with food supplements. So they're thinking that if we don't use food supplements that are in the market, they will not find use. It is not true. Okay, there is a place for food supplements, so they are needful. Only that we are trying to say that for the general population, don't go hearing adverts about a supplement that can improve your overall health, boost your immunity, increase your sexual performance, promising to make you healthy, okay, and prevent disease, and you go buying these things and you are on them for a long time. If you think you have a low immunity, there are diseases that can cause low immunity. There are infections that can cause low immunity. There are medications like steroids that can cause low immunity. So you have to come to a health facility for diagnosis and the condition managed. Food supplements are not the first line of action for low immunity. So if you think you have low immunity, you might have to deal with the underlying cause. Okay? And the underlying cause. And if you think that you need food supplements, we give you food supplements. If you feel unwell, you shouldn't just say that I don't feel healthy, I need my immunity boosted, so I'm going to get some food supplements. What about if that ill feeling is because of some infection you have or some disease you have? So you have to come for proper diagnosis and treatment. and stop looking for food supplements to boost your immunity to fight that feeling of not being well. Okay, so food supplements have their places, but they can have some risks, some adverse effects. Okay, you can react to them, you can feel some side effects to them, and then they can interact with some medications, they can interact with some lab results. All right, so they must be taken when they are properly prescribed, okay, by a qualified medical practitioner. Then also, don't forget that you are actually wasting money on products that don't work, are not giving you any benefits, and might even give you some risk in the long term. So you're not going to have value for your money. In this sense, the value you have for your money when it comes to food supplements has to do with the good feeling you get that I am taking a product that is making me healthy or boosting my immunity. It is in the good feeling you get, but it's not solving any problem for you. Okay? Thank you very much for watching this video and subscribe to my channel. Thank you.